Hi, my name's Taylor and this is the musculoskeletal assessment video. I have already provided privacy and performed hand hygiene, and I have introduced myself to the patient. Hello, can you tell me your name and date of birth?
My name is Angelica and my date of birth is January 1st, 1990.
Okay, and can you tell me where you are?
I'm at Research Medical Center.
And you know what the day is?
Yes, it is Thursday.
Yes. Okay, so the patient is alert and oriented to the person, place, time, and situation. She's calm and cooperative, and she's dressed appropriately for the weather. So can you tell me what brings you in today?
I've been having a little bit of pain in my left wrist.
Okay.
Hand.
Okay. And then can you tell me when did you first notice this pain?
About a couple weeks ago.
Okay. And then can you tell me where the pain is on your hand?
It's kind of like in my fingers,
Okay.
right in here.
Okay. And then how long does the pain usually last?
Kind of is like off and on like throughout the day. Kind of just lingers.
Okay, perfect. And then what type of pain are you having?
Kind of like tingling and like a numbness.
Okay.
Like a dull pain.
Okay. And then have you tried anything that makes the pain feel better?
I notice like when I shake my hand, it like kind of goes away.
Okay. And then is there anything that makes the pain worse?
Not really.
Okay. And then does the pain radiate anywhere beside your hand?
It kind of like goes up my arm a little bit.
Sure. And then I asked you how long the pain usually lasts. You said a few hours.
Mm-hmm.
Okay. And then is it usually worse during the day? Is it worse at night?
Worse at nighttime.
Okay. And then can you rate the pain that you feel in your hand on a scale of 1 to 10?
I'd say probably an 8.
Probably an 8. Okay. All right. And then what medications do you take daily?
Just birth control.
Okay. Do you have any allergies to medications or foods?
No.
Okay. And then any big medical history?
I've had my wisdom teeth pulled, and I think that's it.
Okay. And then, so that'd be surgical history, and then no other big medical history at all?
No.
Okay.
I can think of.
Okay. And then do you use any illicit drugs? Do you smoke? Do you drink alcohol?
I drink wine occasionally.
Okay. And then what do you do as in your career?
I am a dental assistant.
Okay.
I work as a receptionist and
Okay. Awesome. And then are you married? Have children? Anything?
Married, no children.
Okay. All right. And then is there any big family history with your parents, grandparents, or siblings, anything that we would need to know?
My mom has hypertension.
Okay, that's pretty much it?
Yep.
Okay, sounds good. So have you experienced any fever, fatigue, weakness? No? And then have you had any weight changes in the past couple weeks? Okay. And then any nausea or vomiting?
Not really, no.
Okay. And then do you have any recent history of trauma to this hand or any of your hands?
No.
No? Okay. And then any neck or back pain? And then has there been any other pain in any other of your joints besides your hand?
No.
Okay. And then have you noticed swelling in your hand or in any other joints?
A little bit of swelling.
Okay.
Not like a lot where it's like not movable, but just a little bit of swelling.
Okay, good. And then have you had any like leg pain? Did you say you worked out daily?
Yes.
Okay. So do you have leg pain when you're working out or anything like that?
No, not really.
Okay. And then have you had any, do you have a past history of blood clots? No? Okay. And then have you noticed any change in your fingertips when it's cold, like any numbness in them?
Not really, no.
Okay. And then have you noticed any swelling with redness or tenderness in your extremities? You said this was just a little swollen, but no redness or anything like that. Okay. So it says here your vital signs from the nurse were 124/78 for your blood pressure, your heart rate was 67, your temperature was 98.2, your respiratory rate was 18, and your oxygen saturation was 99%. So all that's good within normal limits. I'm not concerned with anything about that. So the next thing I'm going to do is just inspect the hands, and since I've been talking with you, the hands are, they have good rhythmic movement. The fingers are slightly flexed when they're relaxed. I don't see any obvious deformities in the hands or in the fingers. I do notice a little bit of swelling in this left hand that she's complaining of. So the next thing I'm going to do is palpate this. So normally I would palpate and inspect the unaffected hand first. For the sake of time, I'm just going to focus on the affected hand here. So I'm just going to palpate here and just note any deformities. Let me know if you feel any pain or tenderness in anything that I'm doing. And I'll flip over. I'm going to do the same thing here. Okay. And then I will palpate the styloid bone here. Everything feel okay in there?
A little bit of tingling.
Okay, a little tenderness, no problem. And then I'm also going to palpate all 5 of her phalanges and the metacarpal bones. So I'll start proximally and then I'll move distally. Let me know if anything hurts or feels weird. No swelling or anything in her fingers. Everything looks good, and you don't feel any tenderness or anything like that. Okay. So obviously I would repeat it on her other hand as well, but I would always start with the unaffected hand first. So the next thing I'm going to do is test range of motion, and we can just do this with both hands. It might be easier. So go ahead and point your hands down for me. Good. Anything hurt there? Okay, and then you can flex also. Okay, so that was flexion and extension, and then I'm going to test abduction and adduction. So if you'll just have your hands like this and then move your fingers out, good, and then move them in. Sorry.
So out and in.
Yes.
Sorry.
Okay, so everything, there's a full range of motion in her hands, nothing that I'm super worried about. The next thing I'm going to do is do some hand grip strength. So if you will just squeeze both my hands. Good. She's a little bit weaker in her affected hand, nothing major, but she is a little bit weaker in her affected hand. The next thing I want to do is assess the sensation on this affected hand where she says the pain's coming from. So I'm going to use the 2-point test here on your index finger. If you could just close your eyes for me and then let me know if you feel 1 prick or 2 pricks, and I'll do it a few times, okay?
1.
Okay.
1.
Okay.
1.
Okay. So after doing the 2-point test, she does have a little bit of decreased sensation in her index finger of the affected hand. The next thing I'm going to do is the Finkelstein test. So if you will, with both of your hands, put them like this, and then if you will just push them out like that. Good. Any pain? No pain? Okay, that feels okay.
Yeah.
All right. And then the next thing I'm going to do is the thumb abduction test. So I'm going to have you put your palms up for me, and then I want you to raise your thumbs just straight in the air, and then I'm going to put a little resistance on each of them. So this one will be good. Perfect. So she does have a little bit of, she can't quite go against the resistance on the affected hand here. Her other unaffected hand is good against resistance and doesn't worry me. And then the next thing I'm going to do is the to kneel sign. I will go ahead and do this bilaterally. I'll do the unaffected hand first. So let me know if you feel any pain, numbness, or tingling, okay? No? Feels good? Okay. Then I'm going to do it on the affected hand here too.
A little bit, yeah.
Little numbness and tingling? Okay.
Numbness.
All right. And then the final thing I'm going to do is the phalanx test. So if you would, you can just follow me. I want you to go like this and push up against, good, for 60 seconds. And then let me know if you feel any type of numbness or tingling. And you can push out just a little bit. Or yeah, you can just like, perfect, yeah, that's fine. So I would have her hold this for 60 seconds and then let me know if there is any numbness or tingling.
A little bit.
Just a little bit?
Yeah, like in the fingers.
Okay. So we'll go ahead and say she is positive for the phalanx test as well. Okay, perfect. So after completing the test, palpating and inspecting each hand, I've come to the conclusion that it could probably be one of 3 things. The first thing it could be is tendinitis. I think it could be this just because of the decreased sensation, which in her median nerve, which is also an indicator of tendonitis. But for this, she has a negative Finkelstein test, and usually it would be positive for tendonitis. The other differential is a ganglion cyst. It's not likely because there's not a obvious swollen defect. She has a little bit of swelling here, but nothing that would make me think of a cyst in her hand. And then the final differential, which is what this probably is carpal tunnel disease. She was positive for all the correct tests that indicate carpal tunnel disease, and then she also has pain when she does certain maneuvers, like, sorry, not that, but a little bit of swelling, and also she says that it radiates to these 3 fingers, which is the median nerve, and that's part of carpal tunnel disease. And then she was also positive for the Tenniel sign, which we lightly tap over, and she was also positive for the Phelan's test. So I think she has carpal tunnel disease. All right, and that completes my video. Thank you.